So good to see you. Welcome everyone to the Learn, Look, Locate Instagram Live with Dr. Light in New York from NIBRA, and Stephanie in New York as well. And let me just tell everyone a little bit about both of you. Dr. Light is a fellowship-trained plastic surgeon, board certified and specialist, and I'm reading this, with dual practice focused on breast reconstruction and aesthetic surgery. So we are honored to have you not only on our Instagram Live this evening, but also as my newest medical advisor with Learn, Look, Locate. We are really excited to be working with you. There's a lot of work to be done in so many areas, especially Stephanie's story. So tonight we're going to be really taking a deep dive and discussion into Stephanie's unexpected situation with breast cancer. And I don't want to use the word fascinated, but I'm intrigued with her story because as I do this every day, it to me feels like there's just so much education and awareness on every level that needs to be done. And we're so grateful for your advocacy work, Stephanie, and for your willingness to share your story. And Dr. Light's going to be really shedding a lot of light on breast implant illness and breast cancer and a lot of things about what women considering breast implants who have breast implants should know about. So I'm going to have you introduce yourself, Dr. Light, for those that don't know you. Some of my followers might not know who you are,
Sure.
If that's okay.
Yeah, absolutely. My name is David Light. I'm a partner at New York Breast Reconstruction and Aesthetic Plastic Surgery. There's 5 surgeons in the practice. We all specialize in breast reconstruction as well as in aesthetic surgery, specifically natural tissue or autologous breast reconstructions like DIEP flaps and PAP flaps. I'm excited to be on your medical advisor board. I have been following Learn, Look, Locate for quite a while, and I think a lot of the information that you post is critical. There's especially in areas that don't have a plethora of specialists and physicians when they're faced with a breast cancer diagnosis. These things aren't always at their fingertips like patients who might be in like Chicago or New York or Boston. And so, I think disseminating information and educating patients as to what their choices are is really important. And so kudos to you. Happy to help you in that mission and looking forward to being on the team.
Thank you so much. It's very true. And that's why even between the doctors and the survivors and just people in general sharing their stories together here at Learn, Look, Locate, we can make a difference. And we are going to. We're not going to give up. And when we have people like Stephanie reaching out and supporting Learn, Look, Locate and wanting to be a part of this, I welcome anyone who's listening right now. Let's bring our voices forward. And without further ado, let's just talk about, my goodness, what happened to Stephanie and how you two came to meet. And Stephanie, I open it up to you. Why don't you tell us a little bit about, it was almost fate that you shared with me, that you found Dr. Light's really kind of the silver lining.
Absolutely. So a little bit of backstory about me. So I had implants for about 20 years. I did both saline and silicone. And after having my implants, I became aware that I had breast implant illness. I started to get very sick, brain fog. I had skin rashes. I wound up having Hashimoto's, which is an autoimmune. And after I found out that I had all this, I said, there's got to be something going on. And I started to basically do Google and reach out and look at, all the different things on the internet. And I knew that I needed to get my implants out. So in 2019, I found a doctor in another state, and I booked my explant surgery. And I needed to find a doctor that not only did the explant, but also did where they remove the capsule, which is called an end block. That was the most important thing, that I needed to find a doctor that understood that was what I wanted, because I wanted everything out. And my surgery was booked for December, it was May of 2020, and the pandemic hit. So my surgery actually got pushed back to December of 2020. And what happened was my husband, thank him every day, that he wound up suggesting that I find a doctor here in New York. And I did. He recommended Dr. Light, which was the best thing that ever happened to me. I met Dr. Light. He knew exactly what I was asking for. And he actually had a surgery date that was sooner. It was actually October of 2020. So I did my, I went and had my explant with my end block. I was feeling amazing because everything was out. I felt like I finally turned that corner. Yay, the implants are out. I'm going to start feeling better and everything. And on my 2-week post-op, I found out Dr. Light told me, based on my pathology, that I wound up having breast cancer. Actually, it was DCIS. And it was a miracle that it was found. And every day I thank my lucky stars, because I could have went to anybody else, but for whatever reason, God brought me into this path. And Dr. Light, he was the one that discovered that. And it was just a blessing. So
now, I have a question for both of you. Is it general practice when someone gets implants removed to do a pathology report? And if yes, that's one thing. But if not, is it in the patient's hands to ask for this?
I mean, when you're, if you are just removing, if you're removing an implant because there's concerns for breast implant illness, you absolutely should be doing a total capsulectomy, an en bloc capsulectomy, and that capsule should be sent to pathology for evaluation. You know, whenever we're removing tissue from the body, it's usually sent for a pathologic evaluation. But you know, here you have the implants that are causing symptoms, and the concern is that there's also residual implant in the capsule, and so they're removing the capsule and sending it for a pathologic evaluation is definitely part of it. We had no idea that we were going to find DCIS. I sent the capsule, looking for an evaluation for her other symptoms as part of that workup. Really, didn't expect to find DCIS, and that certainly isn't the norm. There's two ways, and Stephanie and I have talked about this multiple times. It's unfortunate that we found it, but it's fortunate that we found it because we found it at a stage 0 at DCIS. And she went on to have treatment and has done very, very well. And so certainly not something that you want to find, but if it's there, you certainly want to have it treated.
So Dr. Light, what percentage of women do you think, and I don't know if there's statistics out there on this, of women with implants that have, whether it be DCIS or any type of breast cancer, and don't really realize it? I think something for me that when I meet people it's not meet people, but people who have implants, I always wonder, I didn't even find my tumor. I didn't even check. So I feel like, oh, well, there's a saline in there. There's not going to be a cancerous tumor. And call me stupid, but this is the reason why I started Learn, Look, Locate. It's like, how do we know this stuff? Can you elaborate on that?
Yeah, there's no, the only really data of incidental findings of breast cancer that we have is with breast reductions. And depending on the study, it's usually single-digit percentage. Okay. So it's not terribly high, but I do a pretty high volume of breast reductions as well, and I think I've found 3 or 4 incidental findings of breast cancer on breast reductions as well. So that's the sort of closest thing that we have information on. Certainly, there's no data that I'm aware of finding a ductal carcinoma incidentally following an explant. And so Stephanie's situation is definitely unique in that. And like I said, depending on how you look at it, I think we were fortunate that we found it and got it treated early.
Stephanie, what would you like to say to anyone listening that is considering getting implants as part of their breast cancer journey?
You know, it's something that I keep saying, like, you know, I wound up having it for cosmetic reasons. Now, obviously, with my journey, I wound up having a double mastectomy, and I was not going to do implants for the sake of what just went, you know, what just happened with me. So I wound up having a DIEP flap procedure done. You know, for women out there that, you know, can't have a DIEP flap because they don't have that extra, you know, fat and stuff. I do know that implants are the, you know, another option for them, and that's something that they would have to decide. You know, I mean, that's really up to the patient. I mean, it's just definitely for cosmetic reasons. I just feel that you know, with what's going on and all the thousands and thousands and thousands of women that are coming forward saying that they have all this breast implant illness symptoms, you know, it's definitely something to really, really, really think about.
And that's a great segue. Dr. Light, what exactly is breast implant illness? Can you discuss exactly what this is?
Sure. So many women who have breast implants, both for cosmetic and reconstructive reasons, develop a constellation of symptoms. The common symptoms are, as Stephanie mentioned, brain fog, which is basically memory and concentration issues. There's joint pain, muscle pain, skin issues, GI issues, pulmonary issues. A lot of the symptoms are very similar to symptoms that you develop with autoimmune diseases. And so unfortunately, there is not a medical diagnosis yet to really sort of define and clarify. But as Stephanie pointed out, there have been literally thousands of women that have had implants, had these issues, underwent extensive workups with dermatologists and rheumatologists and all kinds of specialists, neurologists for migraines and headaches, and, you know, trying to come to a solution or a cause for their symptoms. The workups are usually negative, and ultimately they sort of noticed this was an issue after their implants were placed and opted to have their implants removed. And not all, but many of them have resolution of the symptoms afterwards. And so it got to a point that although there isn't like I said, a technical medical diagnosis, that the FDA even recognized it, and a few years ago included the discussion or mandated discussion for breast implant illness in their patient decision checklist. So a few years ago, the FDA actually put a black box warning on implants and created this with the help of surgeons and patient advocates and patients, created a list of issues to help guide surgeons in educating patients on the risks of implants. And so included in that was breast implant illness. Also included in that was breast implant associated ALCL, which is a lymphoma associated with implants, more specifically textured implants. The checklist included common complications like capsular contracture and implant rupture. Also gave guidance on FDA recommendations for monitoring implants, which this is the one thing that I found a little disappointing in the changes. The recommendation used to be to do an MRI 2 to 3 years after implantation, then every 2 years after that. That actually got extended to you could wait 5 to 6 years after the implants were placed, and then every 2 to 3 years after that. And I can't tell you how many patients I see that come to me with implant issues. And I asked, the implants have been in for 10 years. And I asked them, when was the last time you had an MRI? And they look at me like completely puzzled because they were never told that they needed to have any kind of workup imaging. It was this patient decision checklist, I think, was a move in the right direction, because a lot of patients were told that, you know, implants are, the silicone is inert, there's no issues, we're going to put the implants in, weren't told that they need to have any follow-up for the implants, weren't told that the implants, you know, could eventually rupture, which is also a part of the list, and, you know, basically weren't made aware of the issues that you can run into with an implant. And so therefore, how is the patient armed with that information so that they're aware? You know, so that if the breast starts to become firm, you know, maybe I have a capsular contracture, I need to go to my doctor. Or maybe if I start to have systemic symptoms, I should go back to my doctor. Or if I have a fluid collection, you know, 3 years in my around my implant after my implants were placed, maybe I should be concerned about, you know, breast implant associated ALCL. So unless we have this sort of frank, honest discussion with patients ahead of time about, you know, the risks and benefits of implants, they're not armed with this information in order to sort of advocate for themselves. And so I think that this decision checklist was, like I said, a move in the right direction.
Is there a test to test if somebody has breast implant? Is there any test? No.
No, and that's, you know, I think the diagnostic process for breast implant illness is a little frustrating. There is no test, and so it's hard to really have an understanding of what the rate is, how to make a clear diagnosis, how to know that you're actually removing the implants for breast implant illness. And so the waters there are a little muddy, but it just means that we need to, you know, keep looking at this, keep studying a larger patient population, because, you know, when you look at a study of 200 patients or even 2,000 patients, it may not be a large enough group to really pick up some of these the nuances that help with, you know, detecting, you know, new diseases or understanding new disease. So there is no test. You know, once we discovered that breast implant associated ALCL could be diagnosed with markers from fluid, doing flow cytometry, CD30 and ALK, the incidence of breast implant ALCL went up, because we now had a mechanism to diagnose it, and we knew what to look for, and started finding, you know, more and more cases. You know, when it first, you know, was reported, you know, the incidence was, you know, very, very low. But now, you know, reports are as low as, you know, 1 in 350 to 1 in 550. And so, you know, I think hopefully we get there with breast implant illness, where the diagnostic process is a little bit clearer. But in the meantime, I think we need to listen to our patients, understand that this is a possibility, and, you know, properly work them up and treat them.
I have a question for both of you. What would have happened to Stephanie, Dr. Light, and Stephanie, your thoughts on this as well, if nobody would have figured this out? I mean, I have a personal situation after my cancer that happened to me. Is I started developing severe skin problems, and they tested me for another cancer, and it winds up that I have allergic contact dermatitis, which is a forever now allergic reaction. But the symptoms are so severe, I don't want to get into it, but it happened after radiation, and nobody could figure out what to do with me. And so now it's a lifelong chronic problem. I wonder, when we don't know what to do, or listening to Stephanie, you weren't like quite sure. And, you know, one of the reasons why I started Learn, Look, Locate is because what do we all do? We Google. And it's scary and very frightening. And I asked Stephanie earlier today, she said, I just kept Googling, and she just started putting sort of the pieces together, even for myself. That's why I share my personal situation here. And I still obsess over it. Like, how did this happen to me, right? I'm sure you do that, Stephanie.
Oh, yeah.
So what if Stephanie, and believe me, guys, when I tell you, I work with so many women across the globe that are misdiagnosed for 18 months and are now metastatic because of Paget's disease. You know, God bless Xandra, who we're going to go live with Dr. Israeli and get that awareness out there. But what if Stephanie didn't piece it together? Or what would have happened? And I hate to ask the question, but to me, it's if we don't empower and educate. So.
Yeah, I mean, I think that, you know, if the DCIS had gone undiagnosed, then DCIS will eventually progress to an invasive ductal carcinoma in most cases. You know, the timeline is unsure, but usually it does progress. And so, you know, I think that I don't think that her, I don't think, I'm not, you know, can't be sure because we don't have enough information, but I don't think that the issues that she was having related to her breast implant illness was leading to the DCIS. But I think that it was sort of, you know, like I mentioned, good luck, bad luck, that we had a reason to remove tissue from her breast and happened to find the DCIS.
Well, forget the DCIS for a second, because it's really just the breast implant illness that I'm curious about. What would her symptoms have gotten worse and worse and worse? Yeah. And I mean, I see that on Instagram. Yeah,
absolutely. Yeah, absolutely. Because it was just getting worse and worse and worse and worse. I mean, there's nothing I could do about my Hashimoto's. That's going to be with me for life, and I just have to learn, you know, to deal with it and keep it under wraps and stuff. But definitely, like my brain fog, that was definitely one of the things that cleared up right away. There was a couple of other symptoms that definitely cleared up. Hashimoto's, it's going to be with me for life. So,
yeah, I hear you on that.
But I definitely 100%, I feel that was a contributing factor of my breast implants, because I did not have it in 2000 and in 2008. After having my implants for 8 years, I wound up having Hashimoto's.
How can we help, like if someone has just got breast implants after a mastectomy, for instance, what can they do to monitor and make sure, you know, how do we, I think you know what I'm trying to ask, like, sure. How do we create this type of, yeah.
Yeah, I mean, I think that you, I think that you just have to be conscious and aware. So educate yourself on what the possible side effects of implants are, and you know, I see all of my implant, even long term, you know, years out, I see all of my implant patients once a year, and you know, to do an exam, make sure that on physical exam they're not developing a capsular contracture or maybe signs of rupture or any other issues. Follow the FDA protocols for implant surveillance, looking for rupture, and just, you know, basically they need to listen to their bodies, and if they start developing symptoms or having issues, you know, when you have implants, it's not a permanent device, and so I think that's one of the most important things that patients prior to having implants have to understand. There is maintenance to it, and there are women who, you know, as Stephanie mentioned before, aren't candidates for a natural tissue reconstruction. They're very thin. You know, I always discuss that an aesthetic flat closure is certainly, you know, part of the options following a mastectomy, but there are women that, you know, that's not a path that they want to take, that they are interested in reconstruction. And so, you know, if they opt to undergo an implant, they need just to go into it with their eyes open, aware of what the, you know, the risks are, and pay attention and listen to their bodies.
I want to pivot to the positive, besides the fact that she found you, and that is, and Stephanie and I talked about this earlier, that she got deep flap reconstruction, which I had no idea even existed. Again, one of the reasons why I started Learn, Look, Locate, because I felt I didn't have all my options, and we do have a few questions. We'll jump into those in a second. Sure. But I will say, again, how wonderful it is that your practice offers this type of reconstruction. When we're diagnosed with cancer at a cancer center, deep flap is not addressed. It is not an option and we don't know about it. This is my experience. I don't know if anyone wants to send some hearts up if that happened to them. And so Stephanie was fortunate to be able to reconstruct her breasts and have DIEP flap. Can you guys talk about this? Because I think you have no idea. When I spoke to Stephanie, who did not even know about, you are discussing it with patients. Somebody is saying, thank you for answering my question. Oh, yeah, I just think it's really important, more awareness of the incredible advances, as Dr. Israeli says, that are going on. So let's talk about it.
Yeah, so I think that after reconstruction, so there basically for patients that have breast implant illness, there's a difference between whether you have the implants for cosmetic reasons and you still have your breast tissue versus patients that have had a mastectomy no longer have breast tissue and now are falling into the reconstructive category. So for patients that had a reconstruction, they have implants in and are having symptoms, the option, as I mentioned before, is to remove the implants and do an aesthetic flat closure. And for anyone who doesn't know what that is, it's basically it's not technically a breast reconstruction. That's not the goal of it. The goal is to remove the excess skin following removal of the implant and basically leave the chest wall looking, clean and neat. There's usually a little bit of a longer transverse scar, although the scarring pattern can differ a little bit. And the patient's goal there is not to reconstruct the breast, but basically to be comfortable in their chest and to not have the extra skin that would be there if it wasn't removed. For patients that are still interested in a reconstruction, they don't want to go flat, but they don't want their implants anymore, then the last option is a natural tissue or autologous reconstruction, which Stephanie had. And that can come in different places, different forms. The most common form is a DIEP flap, which comes from the lower abdomen. Basically, the excess skin that would be discarded during a tummy tuck is used for the reconstruction. Other places where we'll take extra skin and fat are the thighs, pap flaps and tug flaps. You can take it from the buttocks, gap flaps, the lower back, the love handle area. So there's all different, areas and combinations that an experienced microsurgeon, and certainly we're not the only practice that does this. We do a very high volume, but if in many states you'll find surgeons similar to us that are doing this, that are offering it to patients. And I think it's an important option for women that either don't want an implant or are having issues with the implants, to have a natural tissue reconstruction to fall back on. I don't know, Stephanie, do you want to maybe expand a little bit from the patient's point of view?
Yeah, so, I didn't even know that was an option, which I was so grateful when I spoke to Dr. Light, because I knew that I wasn't going to do the implants and I wasn't ready to, be flat. So when we discussed it and he said about this DIEP flap, I was overly joyed in the fact that I would be able to do something and still feel like a woman. That was my biggest thing. I just didn't want to feel, like not pretty and stuff. So it was a definite choice of mine, and I didn't jump at it right away. I did the 17 rounds of the radiation. I gave it about a year and a half, and with my journey it was a little up and down, because you go in every couple of months for a mammogram, sonogram, MRI, they find something, they biopsy it, and I just got to the point where after a year and a half I just said, you know what, I think it's time. I think I need to put this in my rearview mirror, and I opted for the double mastectomy with the DIEP flap, and that's what I just had done in February. So
how are you feeling about it all?
Now I am feeling wonderful. Yeah. It definitely was, a bigger surgery that I was not 100% prepared for. I thought I was, superwoman. I was like, I'm going to be great after a month and a half. No, it took me a lot longer, but I'm very happy now. I feel amazing. Everything is going well, and I'm, yeah, I'm extremely happy.
Let me jump in and see if we can capture some of these questions. Sorry for the glasses, guys. Let's see. Somebody's writing in a language. I can't. 20 something breast implants for saline. Saline 20 years ago. I did the implants, but I can't understand. Is lupus can be connected to breast implants? Saline 20 years ago. I did the implants. That's a good question.
Yeah. I don't know that we know the answer to that, or have enough information to make that association. Sorry, I was just reading other questions as they pop up. So yeah, I think that we don't know if lupus is directly connected.
But it's an autoimmune, right?
Yeah.
I think so, yeah. Then Rona, one of my incredible loyal followers, is it customary to send the capsule to pathology to see what's growing on it? Yes, it's a good question. Is it customary?
Yeah, it should be. If you're having your implants removed and you have breast implant illness, those capsules should not be discarded. They should be sent to pathology for evaluation.
Okay, and there's another question about why aren't we talking more about the dangers of radiation to some, like how it can affect the heart and lungs to some? Well, the topic of the conversation really today is about breast implant illness. So I do have a radiation oncologist as one of my medical advisors, and we can put that on the suggestion list because I had radiation.
I think that's a big topic. How radiation affects the body, how radiation affects breast reconstructions. I mean, we can talk for 30, 40, 50 minutes on just that one topic alone. So happy to circle back on that at another time. But like you mentioned, tonight we were talking about breast implant illness and breast implant safety.
Yeah, and then Tina from Canada, I like her question. She said, do you talk a lot about aesthetic flat closure? There's a lot of us in the flat community. I was never presented this option myself. I'm pretty flat by default, but I'm pretty happy with this situation. And this is kind of an ongoing thing. It'd be nice to just touch on that real quick. As Dr. Israeli is really supportive of making sure that all women, I'm sure you are as well, this is something that needs more attention to.
I mean, I think it needs to be part of the discussion. And I think a lot of women who are interested in going flat come to us knowing that. They've sort of done their research. They're not interested in the additional surgery, the additional recovery, and so they I would say 9 out of 10 women that I do an aesthetic flat closure on are coming to me knowing that they want it. The rest may not have considered it, or they consider it a little bit more once they hear what goes on into having a reconstruction, because it is additional surgery, it is additional recovery, and they may not have been a great candidate for a natural tissue reconstruction. They may not have heard liked what they heard when I discussed implants and and what goes on into following up with implants and the maintenance of implants. And so there are some patients that sort of circle back around to it and get a little bit more comfortable with the option. But I agree with you. I do think it needs to be part of the conversation and discussed and made available to patients.
Any last thoughts for both of you? I mean, I think the story has so many levels, and we're just a small little group here this evening, but wow, globally, what we could do to help women all over the world. And see, I'm going to get emotional because I deal with this every day. I just feel this education, Stephanie's story, you, Dr. Light, the work you're doing, it's just so powerful. And you said earlier, and I really appreciate it, that people who live in smaller rural areas who don't have the access to New York plastic surgeons like you. Any thoughts? And Stephanie, any last thoughts too? We kind of threw a lot out here,
Yeah, I mean, I think that if it's not only, you know, rural areas in the middle of the country. I grew up a little bit north of New York City. If you go a couple hours north of Manhattan, and you know, you'll have a hard time finding specialists sometimes. So, you know, I think you know, patients need to advocate for themselves. You, just because you saw a doctor, if you're not 100% satisfied with what they said, or if you just want to hear it from someone else to have confirmation, you know, I think that's completely legitimate. I always encourage people who see me, if you want to have another opinion, by all means, go and get it. You know, I think it's very comforting for people, like I said, to hear the same recommendation from two different separate physicians, because it really gives them confirmation. But I think, you know, advocate for yourself, seek out information. There's plenty of resources. You know, Learn Look Locate is a great resource, and has information on reconstruction, oncology, and all of the different aspects of the breast cancer journey. And you know, if you opt to go with implants, know what you're getting into, know what the maintenance is, and stay on top of it. You know, patients need to be part of their medical care as well. If you're having issues, then certainly go back to your surgeon, and if they won't listen to you, you know, find one that will. You know, there is more and more talk about breast implant illness. There's more and more sort of recognition of it, and I think that if you're having issues, you know, don't live with it. You know, get the proper workup.
It's wonderful news to hear. Thank you. And Stephanie, and before you say anything, Stephanie, I just want to let everyone know that I am so honored to be working with Dr. Light on a dedicated page on the website on breast cancer and breast implant illness. So we're going to work together with Stephanie and my ambassador, Christine Handy, who's gone through this, severely gone through this. Her story is really sad, very, very, you know, lots, MRSA, and so just a lot of things. So we're going to bring it from the patient's perspective to the website, a dedicated page, so that people can really have access to this information. So I'm really excited to bring this to the forefront. And Stephanie, any last words? And we do have one question after you're done there.
I'm just basically, you know, I'm glad that I get to share my story. Like I said, it's the silver lining of my whole journey. And I'm here to help other patients, whether they're going through it or whether they're thinking about getting breast implants. It's just, I'm happy to speak to people and just get the word out. And you know, very happy that my husband suggested Dr. Light, because that is the best thing that could have ever happened with my journey. And I'm very grateful.
Thanks.
So people can DM. Go ahead. I'm sorry, Dr. Light.
No, I was just thanking her. It's very, very sweet. And you know, Stephanie and I have you know, we've known each other for a number of years now, and it's developing into a bit of a friendship here. So, but I still have to thank her for the comments.
Both of them are on Instagram and pretty active. And as Stephanie said, you know, one thing we try to do is, you know, people working together here at Learn Look Locate is, when you put your hand out, we're here for you. I mean, we want to grab your hand and help guide you and give you as much guidance, support, and inspiration to get to to where you want to be. And there was one last. I have extreme itching in center of chest 3 years after mastectomy. Some say it's nerves healing, but others say it's a sign of another cancer. Dr. Light.
Yeah. So it's hard to say, you know, these giving recommendations, you know, in these situations, it's a little bit tough, but specifically, I can't really speak to what's causing the itching, but to my same, you know, comment before, advocate for yourself. If you're concerned, see a dermatologist, go back to your breast surgeon, go back to your oncologist, you know, be comfortable with their answer, be comfortable with the workup. And if you're not, you know, keep asking questions and advocate for yourself.
You can send me a DM because I've been through a lot of the itching with my allergic contact dermatitis, and that could be it. So, well, anyway, guys, this will live on my Reels grid, and I'll share it with both of you. And I'm just beyond honored, and I can't thank you both enough. I know it's late on the East Coast, so I'm gonna say have a good evening, and thank you so much, guys.
Thank you so much, Cynthia. I appreciate it.
Yeah, have a great night, everyone.
Thank you.